subject specialist here for the Advanced Clinical Practice Award. Becky, can I hand over to you?
Thank you, Tim. Yes, welcome everybody to today's webinar. We're really excited to be able to share with you about the Credential. There's a couple of things that we just wanted to let you know before we get started. So hopefully you'll have seen that we've got the Q&A function running. So please do add your questions into the Q&A box. What we will do is we'd like you to vote. We've only got a short amount of time for the webinar, so please do like the questions that you feel the need to ask as part of the webinar. Any questions that we don't manage to answer today, we will do a Q&A and provide those answers to you. So apologies if we don't get through all of the questions. Okay, thank you. If we could go to the next slide. And the next slide. Lovely, thank you. So Tim has done the welcome. Also presenting with us today will be Marie Lancet as well, who's Workforce Development Specialist with Health Education England. And we've also got both Cumbria University and Edge Hill University, who will be presenting and providing an overview of the credentials that are being undertaken and developed, and hopefully we'll kind of get you really excited and wanting to think about applying for those credentials by the end of the session. We'll have a session for next steps and Q&A as well, but as I said, if we don't get through all of the questions, please don't worry, we will come back to you in terms of a Q&A as part of the recorded session. Okay, next slide. So the first thing we wanted to do was just look at actually what advanced practice is. So advanced clinical practice is delivered by experienced and registered health and care practitioners. It's usually developed at a master's level, and practitioners are developed from both a clinical practice experience as well as academic, and they have a high level of autonomy and complex decision making. So really we're looking at professionals who are working at an advanced level of practice with people with a range of complex healthcare needs that are needing that kind of level of depth and understanding, both clinically and in, you know, ensuring that evidence-based approach to practice. We are talking about advanced practice in terms of both the delivery of clinical care, but also about how we clinically lead services, develop and lead education, and undertake research and quality improvement as well. So we've got the 4 pillars, but we recognise that actually all of those pillars interlink together to inform advanced practice. Okay, next slide. So when we're looking at advanced practice within learning disability services, it's no surprise really that actually, you know, these roles will really benefit in terms of how we support the healthcare and well-being of people with a learning disability and or autistic people. We know that both people with a learning disability and autistic people have a higher level of healthcare needs than people without a learning disability and without autism. We know that they have difficulties in terms of kind of multimorbidity and comorbidity. We know that there's concerns around premature and preventable deaths for people with a learning disability. And we know that people have a range of long-term and complex healthcare needs, and that results in risks around polypharmacy, potentially overuse of psychotropic medication, but also thinking about the interactions between both physical health, mental health and emotional well-being. And in terms of the services where we are working with and supporting people with a learning disability and autistic people, people are accessing all healthcare services. So there's a real opportunity with the credentials to be thinking about how we support people to access all services and to have those healthcare needs met. And I think we have a great opportunity to be thinking not just within the traditional learning disability services about developing advanced practice, but also in the wider health care services as well. Okay, next slide. So that's why I think it's fantastic. Health Education England have acknowledged actually the importance of developing advanced practice roles when supporting and working with people with a learning disability and or autistic people. And what's even more exciting is that this is part of the Centre for Advanced Practice. So whilst we're looking at this in terms of the learning disability and autism credential, we're not alone. There are other areas of practice as well that are being developed for advanced clinical practice. And that gives us a greater opportunity to think about how we work across a broader range of services and how we actually link with a number of other pathways for advanced practice as well. So, for example, we've already had contact from the leads for the mental health pathway. We've had contact from the leads for the respiratory pathway for advanced practice, as well as primary care nursing. So this gives us a great opportunity actually to think about how we develop advanced practice across the whole of our workforce when supporting the healthcare needs of people with learning disabilities and autistic people. Okay, next slide. So I'm not sure whether people are already aware of these documents. So we have the core capabilities framework for supporting people with a learning disability. And we also have the core capabilities framework for supporting autistic people. And then sitting above that, we've now got the advanced clinical practice capabilities framework when working with people who have a learning disability and/or autistic people. So this is recognising those core skills and those core clinical expectations in terms of the practice and how we support people with a learning disability and autistic people. But it's now looking at actually how we develop an advanced level of practice so that we're in a stronger position to meet the healthcare needs of the people that we're working with. And encompassed within all of this is person-centred approaches, which is core to everything that we're doing. So I've just put here a picture of the framework, and I would advise people, please do have a look at the Advanced Clinical Practice Capabilities Framework for when working with people with a learning disability and autistic people. It will give you a great level of detail in regards to what we're expecting in the development of the advanced practice credentials that are being developed. I think one of the other things I wanted to share, and it's just on the next slide actually, I think, is that with the advanced practice framework, we are talking about people with a learning disability, people with a learning disability who may have autism as well, but we're also talking about people who may not have a learning disability, but autistic people as well. Talk about children, young people and adults. So this is across the whole of the lifespan of people. There are 5 main domains with 19 different capabilities, and within those there's a greater level of detail as well. And because this is a multi-professional framework, so it's for nursing and allied health professionals, then we've got some core capabilities as well as some profession-specific capabilities. So it really is a very, very detailed framework. The key areas within the framework fit within the pillars of advanced practice, looking at clinical practice, leadership and management, education and research. The focus of the framework is really around the clinical practice, and the domains include the personalised and collaborative working, health and wellbeing, personalised care and support, and risk legislation and safeguarding. And we really do see kind of the leadership and management and education and research really kind of comes alongside that clinical practice as well. So all of these areas, all of these pillars, they all interlink and work collectively to develop people in advanced practice. Okay, next slide. So what we've done is obviously we've developed the framework, and then a tender process has been undertaken to identify higher education institutions to then provide the advanced practice credentials. So what we've asked for is a master's level clinical credentials for multi-professional advanced practice within learning disability and autism. So something which is kind of the equivalent of a postgraduate certificate. It's based upon the advanced practice capabilities framework that I've just given you a very brief whistle-stop tour of, and it is linked to 50% clinical and 50% theory for both content and assessment of the capability. And we're going to hear more obviously about those, the 2 credentials that are being developed shortly. Next slide, please. Key to this is ensuring that we've got co-development and delivery with experts by experience. We'll hear more about that as we go through the webinar. We want to ensure that actually this is accessible to learners nationwide, so across the 7 regions in England, but we also want the credential to be available to the other 3 nations within the UK. The Credentials need to be innovative, particularly in the current climate. We need to be thinking about distance learning and the assessment strategies alongside that. And we really want to ensure that we've got that integration of the wider master's kind of curricula for advanced practice that reflects the integration of the 4 pillars that I've previously mentioned. The other thing that's core to the development of the credential is to ensure that we've got a community of practice for advanced practice in learning disability and autism. There's a few people already undertaking advanced practice roles. As we develop the credentials, as more people undertake this education and training opportunity and undertake the credentials, we need to ensure actually that we've got a forum to connect those people together. And what that's going to enable us to do actually is to think about actually how we build the evidence base around the role and the impact of advanced practice within our services. Next slide, please. So we're really excited to announce that we have both Cumbria and Edge Hill University who were successful through that tender process and who will both give you an overview of the credentials that they're developing. The plan is that these programmes will commence in March 2021, so we're working at a very rapid pace to get that up and running. And the first cohort will complete in September 22. Alongside this, we're doing some work to develop a short film around advanced practice, where we are working with people currently undertaking advanced practice roles or who have been training. And I've talked about the community of practice already. And then we've got the webinar today, but we're also going to do an additional webinar in the new year, which is going to be looking at actually how we work with, from a workforce development perspective, to ensure that we've got opportunities and roles in advanced practice in learning disability services and in supporting autistic people. So that's the next webinar in the new year. Thank you. Next slide. So the plan is to support 40 places, 20 places in each of the, both in Cumbria and in Edge Hill. We're really interested, really keen to hear from people that are interested in undertaking these credentials. So I've added my contact details here. You can find me on Twitter, but I've also added my email address, and I'm keeping an expression of interest list so that we can ensure we keep in touch with you and we let you know the information about the credentials as they're developed, so that if you're wanting to undertake the credentials, we're able to make contact with you. So that's everything from me for now. I'm going to hand over to Anne, who is going to talk to you about the multi-professional credential in learning disability and autism at advanced practice level at Cumbria University. Thank you very much, Anne. I'll hand over to you.
Thank you, Becky, and thank you, colleagues. It's lovely to be here, and thank you very much for the invitation. So I know perhaps you might not be able to see all of us, but I am here actually with some of my team that will be working on the credential together. So as well as myself, I'm the Head of Practice Learning and Partnership Engagement within the University of Cumbria. And currently within my role, I also lead the team of advanced clinical practitioners delivering our MSc in advanced clinical practice and our apprenticeship in advanced clinical practice also. So colleagues I've got here are Cathy Haig. So Cathy Haig is our programme leader for the MSc in Advanced Clinical Practice. And I'm also very pleased to have my colleague from practice, and that's Chris Hutchinson. She's joining us from our local organisation, the Lancashire and South Cumbria Foundation Trust, consultant nurse and approved clinician in community learning disability services. So I do want to welcome both my colleagues here. And I'm going to just lead this very brief introduction to the work we're starting to do on developing the credential, and my colleagues will come in as required, or if there's any specific questions later on to be answered. Next slide, please. Thank you. So our credential has been designed to be an integral part of our MSc in Advanced Practice programme. Our programme is well established as being delivered online, which we've been doing for many years now. So it was really heartening to hear that the credential is being delivered in that, is been commissioned in that way too. So it'll fit beautifully. We're developing 60 academic credits as level 7, as was the requirement of the credential, which is master's level. So if it's going to fit into our programme, what will happen is for the first cohort of students who are undertaking the credential, They will start in March 2021 on our full MSc Advanced Clinical Practice programme. So they will then pick up the credential in November 2021 and will be complete by August 2022. The credential will be available for standalone study, and I'll come on to that in a little bit more detail when I get to the next slide. So we will be starting in March, but they won't be straight on the credential in March. We'll be building it into our MSc programme, credential to start in November 21. So the students who are doing the full MSc will, as I say, complete the credential in the August, but they'll complete their whole MSc by October 2023. That's when it goes through our examination board. So our credential is being designed in partnership with our colleagues from Lancashire and South Cumbria Foundation Trust, of which, as I say, Chris is here today, and the expert reference group, and we'll be working with those experts by experience as we go along through the development of the content of the credential to ensure it is absolutely fit for purpose. And as well as being designed, it's also, sorry, going back to the previous slide, it's designed in partnership. It's also going to be delivered in partnership as well. Thank you. Next slide, please. So when we're talking about the pillars of advanced clinical practice, they'll be already met in our MSc programme, or already met if people who are accessing as a standalone credential will either be an advanced clinical practitioner already, will be working at that level and be able to demonstrate that, or are training to be so. So the pillars of the general pillars of advanced practice will be met in that way, and of course the credential will be written in such a way that there's integration with those pillars, but the individuals will have met those pillars through either the work they're doing at that advanced level or because they are already an advanced practitioner. Of course, the specialist content will be very closely aligned to the Advanced Clinical Practice Capabilities Framework, which Becky introduced earlier. Next slide, please. So just briefly, really, to say about the standalone credential, because currently, as I've described, our credential will be sitting initially as part of our programme as 60 credits. In order to access it as a standalone credential, you know, without the rest of the MSc, you must already be an advanced practitioner or trainee advanced practitioner, or be able to demonstrate that you're working at that advanced practice level in order to be able to apply for the credential. We of course will offer the PGC as a standalone anyway, without the credential process. There may be some people who wish to study just the PGC in its entirety without necessarily wanting or needing to meet a credential. So that'll be offered as well. Okay, next slide, please. So really that was a very brief introduction, because we are currently going through the phase of the actual design of the programme. So so that's going to change quite a bit as we go along and as we get our experts by experience group set up and involved. So the content isn't fully designed yet, but as I say, it will be aligned very closely with the framework, of course, and with advanced clinical practice also. So I've just put on our slides some information around our generic programme for people who are interested in the full MSc. Further details regarding about how the credential, when it's written, will fit into that will be added to that information. And there's our email addresses as well for anybody who wishes to ask anything further. Thank you very much.
Thank you, Anne. That's great. There's lots of questions coming in, so we'll come to those in the Q&A session later. We're just going to hand over to Joanne Kiernan, who is from Edge Hill University. And Joanne, are you happy to introduce yourself?
Yes, thanks, Becky. Thanks very much. Hi everybody, my name's Joanne Kiernan and I will be the programme lead for the postgrad certificate in learning disability and or autism for Edge Hill University. And just to say, I'm delighted that I'm part of this process. I was involved in the actual development of the capabilities framework, and also as a practitioner I'm absolutely delighted that we've now got this opportunity to support our colleagues in practice and ultimately people with a learning disability and autism. Thank you. Next slide. So we've taken a slightly different approach, and what we've developed is a programme, a postgraduate certificate that will run from March 2021. So that programme will be a 45-week programme, and it will run over 12 months. So students who start that programme with us in March 2021 will be looking to have qualification of that postgraduate certificate in 12 months the year after. So we're hoping to have some people qualified by 2022. The actual credential itself will comprise of two 30-credit modules, and those, as said previously, will be level 7 modules, so they're master's levels modules, and they will be delivered concurrently over that 12 months. So students will study both of those modules concurrently over 12 months, and fundamentally and most importantly, those modules will incorporate theory and practice with a 50% division for that. We are moving at speed with this, so we will be validated on the 20th of January, hopefully, but actually a lot of our consultation is underway. We've already gone through our internal QA processes, so we are moving at speed for the 20th of January for a validation. Thank you. So that's how it will look. So having studied both of those modules concurrently, whilst in practice and attending university 1 day a week, the students will have a postgraduate certificate at 60 credits at level 7. Thank you. And how that maps into the programme for the ACP, similar to the Cumbria programme, all the content is designed around those pillars and the capabilities framework. So in relation to how the student could progress with that credential, they can study and leave at the point of the postgraduate certificate, which means that they have those credits and they have that qualification. They could then carry on, if they so wish to, onto the postgraduate diploma by adding an additional 80 credits from our ACP existing programme, so again similar to Cumbria. And if they want to go to the full MSc in advanced clinical practice, they would then go on to the 40 credit module, which is around research inquiry. Thank you. So again, from a programme management point of view, we're part of, as Cumbria is, the HEA steering group, and that's been a really informative group to be involved with. And we have our usual Edge Hill stakeholder partnerships. We are designing with experts by experience, and they've been involved in our process. We've got a really vibrant service users forum here, but also we are extending that to make sure that we're getting good representation across the groups that hopefully will benefit from this programme. So we're using experts by experience both in the design, but also will be in the delivery as well. We're co-designing with our practice partners, and as Cumbria is sat in the Northwest, we've got a variety of practice partners, and we're going right across Merseycare all the way through to independent providers as well. We've got our community partners, and that's our people who are working in the private and independent sector, and we're really keen to include them as well, because as Becky talked earlier, this is a multi-professional programme, and we're keen to make sure that it's represented as such by the people who come on the programme. And also we've got some national stakeholders involved. So for instance, we are talking to the National Autistic Society, etc., in relation to making sure that we're because it is a national programme, although both programmes will sit in the Northwest, we feel very lucky to have that, but actually we're really making sure we're involving our national stakeholders. We have a student community practice, and Cumbria and ourselves have agreed that we're really hoping to form that community practice across both universities, so that we make sure that those 40 students in total will have that community of practice on this new innovative the programmes that are being developed. So it means that we can actually create that community practice from networking and support point of view, and it'd be great for those students to have that community to support with, but also feeding into the wider ACP community to make sure that they're networked in, and also the Centre for Advanced Practice, as explained by Becky before. We're about celebrating advanced practice in this field, and we want to make sure that everybody's linked in with that. Thank you. So there's my contact details. I am the programme lead, so I'm the point of contact at the moment, and I just put a link to our university as well if anybody's not you know, aware of our university and want to have a look at some of our facilities and things. So yeah, I think that's me finished, and I'm delighted that I was able to present for you.
Thank you very much. We've got lots of questions. I'm going to hand over to Marie, who's going to support with the Q&A session. And Marie's our workforce development expert.
Hello, I work for HEE. I'm on the National Learning Disability and Autism programme, and I'm one of the 3 workforce specialists. And what I wanted to talk about this morning was the next steps. So the steering group has been formed. We've got the second meeting later today. We've said that we would provide some further written information on the programme, and I know that's what a lot of people are asking for. So we'll be working with Cumbria and Edge Hill to provide you with that information. As part of the tender, we've said that HEE will work with the universities around the recruitment of students, around the 40 students, and we need to bottom out the detail of that. And we're also doing work on how the 40 places will be allocated, both geographically and by professional groups. Given that this is a multidisciplinary credential, we want to ensure that it really is multidisciplinary, because that's one of the benefits of undertaking this programme, that we bounce ideas off the different professions. It is person-centred, and I think there's a real benefit to that. We've had a great deal of interest in this programme already. The advanced practice leads are providing some numbers, and I have contacted both universities to see if there will be additional places that trusts or regions can purchase. Edge Hill have come back to me already, and if people particularly want to know about that, then please contact Joanne as the point of contact, and she will give you further details about the Edge Hill programme, and I'm sure Cumbria will be doing something similar. So that's it from me. Thank you.
That's great. Thank you very much, Marie. So we're going to move into the Q&A. Please bear with us whilst we look for the most voted questions. We're all getting used to the webinar process. What we'll do is we'll try and divert the questions to the right people who are on the panel. And I know that there have been a number of answers provided, but it may be beneficial for us if we've got time to go through some of those as well. So the first question, and I think I'm going to direct it towards you, Tim, if that's okay, is the training fully funded with money for backfill?
So for the 40 places, the fees are funded. The places will be provided free for this credential, but there is no money for backfill.
Okay, thank you. The next question is, can this be done whilst working full-time or part-time? So do you want me to answer that, or it may be helpful for the universities to talk about some of their experiences previously with people that are undertaking the advanced practice programmes within the universities as well. But my understanding is that this can be undertaken whilst working. The expectation is that this needs to be linked to clinical practice. So, you know, the understanding is that people would be in their workplace developing those clinical skills alongside the academic learning as well. But I'll hand over to Joanne and Anne to give you their experiences of people undertaking advanced practice programmes as well.
Do you want to go first, Anne?
Yeah, thank you. It's really difficult to see who's there, sorry. Absolutely, Becky, totally agree. Our current MSc Advanced Clinical Practice programme is part-time. If it's okay, I'll hand over to our programme lead, Kathy, if you're okay, Kathy, just to bring in your expertise in this, in our students that we've currently got and how they manage whilst working. Thank you.
Hi all. We do have students that undertake the programme part-time and are working full-time. It is a little bit more difficult when you haven't got any time away from the workplace to be able to attend. But with it being a distance learning course, then there is no attendance, no need for you to get in the car and travel so that time can actually be saved. So it is very doable, and as it's 50% in the classroom and 50% within the workplace, then I see no reason why people can't undertake it in a part-time way. Joanne?
Thank you. Thanks, Catherine. Yes, absolutely. I think the programmes are similar. You know, the ACP programmes are similar, so the same applies. So Edge will be using PebblePad, which is a live document which will support assessment in practice. So absolutely, people need to be practitioners, and yeah, as always, they'll be working and juggling some of those plates together. But I think both universities are really well set up to support students to do that, and the flexibility around the distance learning, as Catherine said, is around supporting people who are working in the workplace on shifts and things. That should hopefully make it easier for people. Thank you.
Thank you, that's really helpful. The next question is, will there be a way of ensuring all the different professions are represented on the courses and that there is equal opportunities for allied health professionals and nurses to apply? Maria, I think you touched upon that in your presentation. Would you be able to just respond to that question for us, please?
I think that's something that we've got to discuss with the universities and also the steering group about the allocation of places. So I'm not dodging the question. It's just that we haven't got there yet, but it's something that we're really committed to doing.
That's great, thank you. And what we're doing as well is we're ensuring that as part of the steering group and the reference group that we have got the different professions represented as well, so that we can ensure we've got that balance in terms of supporting around curriculum development and things like that. We've got those kind of consultants ready lined up to support both Cumbria and Edge Hill with that as well. But it is a very important question. It's something that very much is on our minds, that we do want to ensure we've got that multidisciplinary representation. And the advanced practice short film that will be coming out hopefully in the new year actually does provide an example where they have got advanced practitioners from speech and language therapy, from nursing, I'm trying to remember off the top of my head, I think it was occupational therapy and physiotherapy. So, you know, they've been able to really share their experiences of having advanced practitioners as a multidisciplinary team. So that would be really helpful, I think, for people to see that. So yes, it's a good question, really important to us as well, and we will definitely hold on to that. Okay, so the next question that I can see here, it does keep moving, so apologies if I missed something. How would this interlink if you already have a profession-specific master's in advanced practice? So this is for people, I'm just going to try and clarify, so I'm presuming that this is where somebody has undertaken an advanced practice master's programme already and completed that programme. I think that we were talking about, I think particularly as part of Cumbria's presentation, that if people would then further benefit from undertaking the advanced practice credential for supporting people with a learning disability and autistic people, then that is still available for you. The other thing I would talk about here is about how we think broader than just the credentials, and we think about the importance of the development of the community of practice. So we'd still, if you have undertaken an advanced practice programme already, but you are interested in the community of practice, we'd still like to hear from you, because I think that's going to be a real strength in terms of how we work together as advanced practitioners and support one another, but also build that knowledge and impact about the roles as well. So please do keep in touch, and I'm happy to respond to kind of individual questions as well via the email address that I've provided.
Becky, there are a couple of questions here about the distance learning aspects, and I wondered if we might invite our colleagues in to explain how that would work. Should we start with Cumbria? Is that you have to do that?
Yes, I am, thank you. So we've been running our programme Distance Learning for 20 years in various guises. So we are very used to teaching and learning within an online environment. We use Blackboard as our learning platform, and students are invited as adult learners to engage with tasks set and information given over a period of time which is asynchronous. So the learning can take place in their own time. They don't have to do it between 9 and 12. They can do it whenever they like within a set period of time. And all of the work that they undertake over those number of weeks are constructively aligned to the assessment for the end of their module. And we will continue that for the credential. Joanne?
Thanks, Catherine. Yeah, very similar. We're also utilising Blackboard. I think most universities have become even better at online learning in the current situation. So the idea is to create that flexible platform, that ability to contact people, and also the ability to access that learning at any point in time, as Catherine's just said. So we are aware that people have got, you know, the work-life balance shifts, etc. So it's about creating programs that are flexible enough to make sure that people get the same learning experience as if they were actually, or as near to, as if they were actually you know, on campus. And again, we're used to doing that. Our ACP program is delivered nationally as well. And you know, we've you know, most universities are fairly au fait with that. And the other thing is that for those students who might be maybe not as experienced in using some of those technologies, the universities have really good support packages in place to get people up to speed and make sure that they're able to access that in a way that suits them. So yeah, thank you.
That's great, thank you. There's a question here, just wanting some clarification. I can see that Anne's responded to it as well and picked up on it as well. So people are getting a little bit confused in terms of not sure what's being offered, whether it's a postgraduate certificate, a master's programme or a standalone credential. So I wondered if both Cumbria first and then Edge Hill, if you could just provide that overview in terms of how you're providing the credential and how that fits within your wider programmes. That would be really helpful, just to clarify. Thank you.
Okay, thank you. I've written my response was, in effect, it's all three really, because it can be all three. So I can see how it's confusing though. So the credential itself is being designed, both universities, it's a 60 credit sort of unit of study. So that could be studied on its own as a PG cert, a postgraduate certificate, and then you would have the credential as well. What we can also do is, for our programme, it'll already sit within the programme as part of the MSc. And as Joanne's explained, again, with their programme, it can be either standalone, I'm sure she'll go on to describe it in more detail, or sit as part of the MSc. So whilst it sounds a bit confusing, you can opt to either study it in its entirety, as long as you meet the entry criteria, which is around being able to actually demonstrate you're working at that advanced practice level, so then you'll be able to apply the learning that you undertake at that advanced practice level to your own practice. Or you may already be an advanced practitioner, as somebody had already alluded to earlier, or you may be on another training programme, say that you were studying advanced practice at a different institute. The way that ours is, and both, I imagine, both universities have designed the programme, is that according to your home university's APEL regulations, there's no reason why you wouldn't be able to APEL that into a broader programme. So there's lots of options actually. So I would suggest, and I'll hand over to Joanne in a sec, that, you know, if you were wondering about how both universities in detail work, then just drop us both an email and we'll be more than happy to talk you through it. But thank you. I'll hand over to Joanne.
Thanks, Anne. Yes, and I think I can't actually see all the questions. I do apologise, but I've just seen one. So yeah, ditto in relation to what Anne's just said. Thanks, Anne. But I think the difference between the universities is when those actual credentials start, if you like. I think that's probably the main difference. The credentials will look similar because we're working within the same frameworks. But someone's just asked about the funding. My understanding is the funding is for the PG cert, that actual credential. It doesn't fund the whole programme. So the difference between the universities are around where that sits within their programme, with both of those, with the credentials being able to map into using the e-portfolio and some of the credits based on the APEL, as Anne said, in relation to the full programme and particular exit routes. So designed really in a bespoke way to support practitioners and professionals whatever they need, if you like, whether they want to go for the full programme or whether they are already a qualified advanced practitioner and need that support around LD and autism from a PG Cert point of view. So I think both programmes are quite flexible in relation to that. Thank you.
Thank you. And Tim, would you be able to just clarify, Joanne just touched upon the funding for the credentials. Would you be able to just clarify the process around that funding in terms of what is funded and then how people would access potentially additional funding for the remainder of the Advanced Practice Masters programme if they were undertaking that? Yeah, so people would access the funding. The funding is for that specific piece of learning, and they would access the funding either via their advanced practice leads and applying for the courses. We'll work out a method by which people apply for the 40 places that are funded. The rest of the courses they would need to find either from within their trust, or that they would pay for themselves, or from a funding scheme within their region. So it's open. If you want the full award, if you wanted a full MSc, you would need to find that funding from elsewhere by whatever your normal routes are into education. And was there another question, Becky? Am I missing something? Was there another one there? No, I think that was the question. That's great. Yeah, it's also possible for people to buy places by those other routes onto the courses. So we wouldn't want to think that that's it. Once we hit the 40, there are no more places, because I'm sure Edgehill and Cumbria would welcome as many as they're able to take. That's great. Thank you very much, Tim. Oh, I think we've got some more questions coming in. I'm aware of time, so does the live link close automatically? No, when we end it, the live link will revert to being, people will be able to see the whole session again. Okay, lovely, that's great, thank you. I was just aware of the question in terms of the time commitment for learners and for their employers releasing them to study. So, Joanne, could we come to you first and then over to Anne and the team from Cumbria?
Yes, thanks, Becky. So in relation to the Edgehill programme, we envisage 1 day actual content learning, but of course there'll be direct to study, etc., to support the students' understanding, but 1 actual day in relation to the online engagement with the programme. So that would be 1 day over 12 months. Is that 1 day a week, Joanne? Oh, sorry, yes, 1 day. I do apologise. Yes, okay. 1 day a week. Yeah, 1 day a year. That would be a bit poor. So 1 day a week. Yes, I do apologise. Yes. Thank you. And Anne and the Cumbria team.
Hi, thank you. I'll just hand over to Kathy shortly, but just to say that, you know, very similar really, but the way that our programme's designed is that we wouldn't be saying we need you in a particular online environment on a specific day necessarily. Probably very much like Joanne, you would say in your team, it's kind of an equivalence really. So there might be some synchronous and some asynchronous type of learning. Kathy, did you want to add anything really in terms of that in your experience?
No, asynchronous works better. So long as it's within a defined time frame. Yeah. And obviously the use of tools like Collaborate can allow lecturers to actually upload lecturers and again be watched asynchronously with tutor input on Q&As later on after that's been published. So yeah, very similar approaches.
That's great. Thank you very much. I've just got a final question, and then I think we're going to need to end for the day. But if there's questions we haven't answered, we will look at those and come back to you. There's a couple of questions in terms of access to the credentials for people professionals who may not be nurse or an allied health professional, but maybe working in social care services. Maybe pharmacists, and people are asking whether there's opportunities for those professions to be able to study this credential. Joanne, could we come to you first and then again over to Anne and the Cumbria team, please?
Yeah, so my understanding is that this credential it's developed at level 7 and is for registered practitioners, is my understanding at the moment, with post-registration experience of about 2 years, but then talking about the actual role that they're doing in practice. We absolutely acknowledge that people are working at quite a skilled level, so access to the programme would need to be done. I think HE will clarify that for us, but also in relation to RPELing or APELing in, but that would be a process that each university has in relation to access to their programmes. Yeah, I'll pass over to Cumbria, but in relation to individuals, I think that would be done on an individual basis, but my understanding is that it would be post-registration. Anna and Catherine, I don't know if you want to add to that.
Thanks, Joanne. Yes, very much so. From the academic perspective, of course, we'd obviously want our prospective students to be able, you know, to demonstrate that they will be able to study at that level 7. So in terms of the academic criteria, but in terms of different professionals, we're absolutely welcome registered healthcare professionals from across the range, really. The most important thing, though, is that they're demonstrating that they are actually able and are going to be working at that advanced level, because it is around advanced practice in this field of practice. And I wonder if my colleague Chris and or Kathy might just want to come in there at all, just to elaborate a bit more. Anybody there? Are you there, Chris?
I am. I think you've covered it all there, Anne, really. I think obviously people have lots of different roles in practice, so it's very difficult to say you have to be in this set job in order to be considered to be, you know, working at that level, able to study at that level, all those sorts of things. So I think some of the questions we're going to need to look at on an individual case by case basis as applications come in, and assist you with your thinking and your career and your development planning at that point, if that's the case.
Yeah. Thank you very much, Chris.
Thank you very much. That was a really helpful Q&A session, actually. I think we had lots of questions. We will go through all the questions again to make sure that if we haven't had a chance to answer them, that we do provide that those answers to you. Just wanted to say thank you very much to everybody for their time today. It's been really helpful. We're very, very excited to be working on the development of the credentials, and actually to be seeing the advanced practice framework coming into fruition, really, through the development of the credentials, and even more excited actually about the potential for these roles and the potential for these roles to make a difference in the healthcare, meeting the healthcare needs of people with a learning disability and autistic people. And that's fundamentally what this is all about. This is about how we are able to overcome the health inequalities that people are experiencing. And this is a tremendous opportunity for us to work across the professions and to really have an impact on health and wellbeing for people. So thank you very much to everybody for their time. The session has been recorded, and we will be sending or sharing the link to the recorded session. So please do keep an eye out for that as it comes out. And hopefully you've had our contact details in the chat and throughout the presentation. So if you've got further questions that you weren't able to ask today, please let us know. We do want to answer as many of the questions that you have to support as many people as possible, really, to undertake this level of practice and learning. So thank you very much to everybody.
Thank you, Becky. Just in terms of the link that people have now that they use to join this meeting will be where the recording sits. It'll take a little bit of time to process, but you should be able to start the recording again shortly.
That's great. Thank you. Take care.
Bye.
Bye.